stopped using in my private. Yeah. So silk is something which I've almost stopped using in my practice. I'll tell you the reasons why. All right. So suturing, surgical success recipe, suit together. Be it anything that you do extraction or do an implant surgery or do any perioflap surgeries, if it is not sutured correctly, the entire surgery will fail. Imagine you're doing a implant surgery, you've done a bone graft, you've spent a lot of money on the bone graft, the membrane, the implant. You finally close it together after 3 days. The patient comes back, sir, suture is dangling from the right side, everything is open, everything goes to waste. So this is just something that, you know, where did we go wrong? Did we go wrong during a surgery? Or did we go wrong during a suturing? Or did we use the right sutures for our surgical success or not? So that is what we are here to learn. Yeah. So you guys can unmute your microphones at any point if you have any questions. We just a few people here, so we can have a group discussion instead of a lecture. Yes. So this is a little about me. Thank you so much, sir, for introducing me. This is my number. Yeah, okay. So suturing essentially means to sew or seam. In surgery, suturing is the act of putting two things together. We have to hold them in place till the time the healing occurs, right? So what is suture? Suture is a strand or a material or any thread which is used to close the vessels or the skin together. It is derived from the word sutura, right? So let's learn the history. I mean, suture is suturing is something which has been there since ages. Time में yeah, it uh, so place the ants, the march the head into place. Strings in the earlier days. So Races of Arabia was credited with that. And our very own Listerine that we use every day that we prescribe to the patients, Joseph Lister was the first to invent the disinfected sutures. So he dipped the sutures in carbolic acid and he made them sterile. So he was the first person to do that. What are our goals of suturing? We have to maintain the proper flap position, hemostasis, support for the tissue margins, post-operative pain prevention, bone exposure prevention, so many other things. I'm so sorry. Okay, so suturing is there to provide adequate tension, maintain hemostasis, provide proper tissue support, reduce pain. Everything is there revolving around. So the entire surgery, the success of the surgery revolves around suturing. I don't think the patient will tell us, never mind, doc, I'll do my own sutures. We have to do it for him. Okay, so what is an ideal suture material? It has to have an easy handling and not security. So when you take out a suture from the kit or from the sterile video blur,
Blur.
blur, just give me 1 second. How do we deal with this? Sir, can
Now,
you help me out with this?
now you are visible. Now you are visible.
Now I'm visible. Just give me 1 second. Is there any filter applied? No. None. Everything is none. I don't know why. What happened? Anyways. Yeah. Okay. So I have certain suture materials over here. So when you take out suture material from here, it should be absolutely sterile. It should not be that you are suturing and it tears off, or you're suturing, the knot does not form well. So that is not security. When you form a knot, it should stay there. It should not get loose. That's not security. It should be sterilizable. We all know that. It should be non-reactive, which is very, very essential. Have you all noticed that when you place sutures, after 7 days, when the patient comes in, and all the plaque accumulation, the food debris is there on the sutures? Have you noticed all of that? That is the reason we
Yes.
remove it after 7, 8 days. Yeah. So it should be non-reactive. No plaque should form. See, patients any which ways lack oral hygiene. They don't clean very well. So if you're placing a suture, at least the suture should be able to get rid of the food debris on its own, not stick to it. So that's the reason I don't like silk. You have to remove it in 7 days, and a lot of material gets onto it, just like over in the picture over here. Okay. Low capillarity. So, a multifilament suture or a silk suture, the moment you put the suture, have you all noticed this that after like 2 or 3 knots, the suture tends to pull, or there is a little friction because the blood gets soaked up on the filament over there. That is the reason it should have low capillarity. Capillarity means the ability of a material to soak up the fluid. For example, if you put a tissue paper in the water, the tissue paper immediately becomes totally wet. Right. So in the same way, tensile strength. So if you see in the picture over here, I've pulled this suture up quite tightly. So it should not break. It should have adequate strength. So even if I'm pulling it to maintain hemostasis, it should not break at all. It should be possible.